Okay, so we will be looking at nasal cavity. Nasal cavity is divided into two halves. Nasal cavity is divided into two halves by nasal septum. One half cross section is here, and it is formed by a septum that is mainly formed by vomer bone that forms septum, and conchae are turbinates. There are superior meatus and inferior conchae that separate the bone. Superior and middle meatus are the part of ethmoid bone. Okay, so in this image you can see, and there are inferior conchae, and then there comes maxilla. Maxilla is upper jaw, anterior hard plate, laterally nasal cavities. Floor is formed by the orbit, and it meet in the midline by intermaxillary suture, infraorbital foramen alveolar process, and contain maxillary sinus that is lined by mucous membrane, opens into nasal cavity, act as voice resonant. This is maxilla. Another one is zygomatic bone, that is cheek prominence. Zygomatic bone forms cheek prominence, and as you can see here in this image, zygomatic bone forms cheek eminence, and it is part of lateral wall of the lateral wall and floor of orbit, and its articulation is medially in maxilla, laterally in temporal lobe, and forms zygomatic arch. Clinical importance of facial bones, facial fractures. Nasal bone fractures most commonly due to prominence nasal bone. Maxillary fractures occurs due to anteroposterior blow, or there is blowout fracture. Orbit floor in maxillary sinus may be fractured. Infraorbital nerve can be damaged. Zygomatic fracture results into the blow on the side of the face, are common road accidents. Zygomatic fracture can happen. Okay, terion. Here, this condition, this area is known as terion. It is junctional part of the frontal bone, parietal bone, and wing of sphenoid bone, and temporal bone. Their meeting point is known as terion. Thinnest part of skull is there. Anterior deviation of medial meningeal artery overlies here, and fracture results into the epidural hematoma. Epidural hematoma can be occur at the fracture of terion. Hard palate is formed by the palatine process of maxilla, horizontal plate of palatine bone. Hard palate is formed. Conchaes are there, separated by posterior border of vomer, and bounded by laterally by medial pterygoid plate, and pterygoid humulus is a hook-like